We are creating awareness on why Black and South Asian people in the UK have been hit the hardest by COVID-19. There were at least 3,876 deaths of Black and minority ethnic individuals in hospitals in England up to 9 June 2020. Where ethnicity is known, BAME people represented 15.5% of all deaths to this point. These numbers do not show a great disproportionality in BAME deaths, but once we account for demographics such as age and location, a different story is told. Based on COVID-19 deaths by location, some of the highest death and hospitalization rates during the outbreak have been in London, where 40% of the population are from ethnic minority backgrounds. But even when you adjust for where the coronavirus outbreak had hit hardest, the Office of National Statistics, the Institute for Fiscal Studies, Think Tank, and Public Health England all conclude that people from ethnic minorities are being disproportionately impacted. It estimates that the deaths of Black Africans are 3.7 times higher than might be expected by geography and age 2.9 times higher for Pakistanis and 1.8 for Black Caribbean people. Public Health England, which approached the issue in a similar way by adjusting for age, found similar disparities in both the infection rate and deaths for BAME people. The ONS research goes one step further than these reviews and looks at the factors such as health and deprivation. It concludes that Black people are 1.9 times as likely to die as white people. Bangladeshis and Pakistanis are 1.8 times as likely to die. Indians are around 1.5 times as likely. Analysis from Public Health England showed that once in hospital, people from BAME backgrounds were also more likely to require admission to an intensive care unit. BAME people accounted for 11% of those hospitalized with COVID-19, but over 36% of those admitted to critical care. According to the Office of National Statistics, the death rate in the poorest communities in England and Wales is twice as high as the wealthiest. Issues with self-isolation in larger households could also play a factor. Just under a third of Bangladeshi households are classified as overcrowded, as are 15% of Black African households. According to government statistics, only 2% of white British households are classified as overcrowded. Black and other ethnic minority individuals make up a large share of jobs considered essential in tackling the virus, many of which are public-facing jobs, such as taxi and cab drivers and chauffeurs, security guards and related occupations, care workers and home carers, bus and coach drivers, nurses, cleaners and domestics, postal workers, mail sorters, messengers and couriers, food, drink, and tobacco process operatives, van drivers, vehicle technicians, mechanics, and electricians. 1 in 5 people working for the NHS in England, for example, is from an ethnic minority background, and these numbers are even higher when we look solely at doctors and nurses. Public Health England, through engagement with members of the public and experts, found that structural racism could also play a part. Historic racism and poorer experiences of healthcare or at work may mean that individuals in BAME groups are less likely to seek care when needed, or as NHS staff are less likely to speak up when they have concerns about personal protective equipment or risk, the report says. A recent survey of NHS staff found that 29% of BAME staff felt bullied in the past year compared with 24% of white people. There are major reasons why the BAME community should follow government regulation to help reduce the risk of COVID-19.